Imagine this. Your kidneys are quietly working behind the scenes every second of your life. You don't see them, you don't feel them, and most of the time, you don't even think about them. Yet these two small bean-shaped organs are filtering nearly 50 gallons of blood every single day, removing waste, balancing fluids, and keeping your body in perfect chemical balance. Now here's the scary part. Kidney disease is called the silent killer for a reason. Most people have no idea something is wrong until their kidneys are already damaged. By then, treatments become harder, and recovery may not even be possible. But here's the good news. Your body actually gives you warning signs. The problem is that many people ignore them, mistaking them for stress, aging, or just normal tiredness. In this video, we're going to reveal 17 early warning signs of kidney disease that you must never ignore. Some of them may surprise you, and if you catch them early, you can protect your kidneys, your health, and even your life. So, grab a notebook or just pay close attention, because we're starting with one of the most overlooked symptoms. 1. Changes in urination. The very first sign shows up in the most obvious place, the bathroom. Your kidneys are in charge of producing urine. They decide how much, how often, and what it looks like. When your kidneys start to struggle, urine changes are usually the first red flag. Now, what kind of changes are we talking about? Frequency. Do you suddenly find yourself urinating far more often than before, especially at night? That could mean your kidneys are losing their ability to concentrate urine. On the flip side, if you're barely urinating at all, that's also a danger signal. Appearance. Take a closer look. Is your urine foamy or bubbly? That can mean protein is leaking into it, which is a classic sign of kidney damage. A healthy kidney keeps protein in your blood, not your urine. Color, dark, tea-colored, or even bloody urine is another sign something may be wrong. Here's a scenario. Imagine you've been waking up 3 or 4 times at night to use the bathroom, when before you slept through. You may think, oh, maybe I just drank more water. But if this continues night after night, it's not just about water, it could be your kidneys asking for help. 2. Swelling in the body, edema. Now, let's move to the second sign, swelling. Healthy kidneys act like natural filters, removing extra salt and water from your body. But when they stop working properly, that extra fluid has nowhere to go. It collects in your tissues, leading to swelling, also called edema. Where does this swelling usually show up? In your feet and ankles. Shoes that used to fit suddenly feel tight. Around your eyes, you wake up with puffy eyelids even after a good night's sleep. In your hands or fingers, rings don't fit like they used to. A lot of people mistake this swelling for just being tired or eating too much salty food. But if swelling keeps coming back, especially without an obvious reason, your kidneys may be the ones to blame. Example, think of a sponge. When it's dry, it absorbs water easily. But if the sponge is already full and can't release water, it becomes heavy, soggy, and swollen. That's exactly what happens in your body when the kidneys can't get rid of extra fluid. 3. Constant fatigue and low energy. Let's be honest, everyone feels tired once in a while. But this isn't the normal, I stayed up late, kind of tiredness. This is a deep, ongoing fatigue that doesn't go away even after a full night's sleep. Why does kidney disease make you feel this way? Here's the science, simply explained. Your kidneys produce a hormone called erythropoietin, EPO. This hormone tells your bone marrow to make red blood cells, which carry oxygen throughout your body. If your kidneys are weak, they don't make enough EPO. That means fewer red blood cells, less oxygen, and more exhaustion. This condition is called anemia, and it's very common in kidney disease. The result? You feel drained, weak, and sometimes even dizzy, as if your body just can't keep up, no matter how much you rest. Imagine walking up a single flight of stairs and feeling like you just ran a marathon. That's how people with kidney-related anemia often describe it. It's not just tiredness, it's your body literally starving for oxygen. For trouble sleeping. Have you ever tossed and turned at night, unable to find rest, even though your body feels exhausted? Poor kidney function may be to blame. When kidneys can't properly filter waste from your blood, those toxins remain in your system. This buildup makes it harder for your brain and body to relax. Some people develop restless leg syndrome, where the legs feel twitchy or uncomfortable at night. Others struggle with sleep apnea, where breathing repeatedly stops and starts during sleep, a condition strongly linked to kidney disease. Picture this. You lie down after a long day, close your eyes, and within minutes, your legs feel like they're crawling. You keep shifting, stretching, but nothing helps. That's not just stress. It could be your kidneys waving a red flag. 5. Dry and itchy skin. Your skin is like a mirror, often showing what's happening inside your body. When kidneys aren't working, they struggle to balance minerals like calcium and phosphorus. This imbalance, along with toxin buildup, can lead to dry, irritated, and itchy skin. Unlike normal dryness, kidney-related itching is often deep and relentless. No amount of lotion seems to fix it because the problem isn't on the surface, it's in the blood. Example, think of your kidneys as water filters. If the filters are clogged, impurities flow through the water. Similarly, if your kidneys can't filter waste, your blood becomes impure and your skin reacts with constant itching. 6. Shortness of breath. Climbing a few stairs shouldn't leave you gasping for air, but for many people with kidney disease, it does. There are two main reasons. Fluid buildup in the lungs. Weak kidneys let excess fluid accumulate, making it harder for your lungs to expand. Anemia. Fewer red blood cells mean less oxygen traveling through your body. Together, these make even light activity feel like running uphill. Imagine walking to the kitchen and feeling like you've just finished a sprint. That breathlessness isn't about being out of shape. It could be a kidney warning. 7. Puffy eyes. We all wake up with puffy eyes once in a while, maybe after crying or not sleeping well. But persistent puffiness, especially in the morning, is another story, because healthy kidneys keep protein in your bloodstream. When they're damaged, protein leaks into your urine instead. This loss of protein causes fluid to collect around the eyes, making them look swollen. If your eyes are often puffy even though you're well-rested and eating healthy, it's worth asking your doctor about kidney health. 8. Poor appetite. Losing interest in food might not sound alarming at first. Maybe you think it's just stress or a temporary stomach upset. But when it becomes a pattern, it can signal kidney trouble. Here's why. When kidneys don't filter waste efficiently, toxins build up in your bloodstream. This makes food taste bland or even unpleasant, sometimes leaving a metallic taste in your mouth. You may feel full quickly, even after eating very little. Example, imagine sitting down to your favorite meal, but instead of enjoying it, you feel no desire to eat. After just a few bites, you push the plate away. If this keeps happening, your body isn't just rejecting food, it may be reacting to toxins caused by weak kidneys. 9. Muscle cramps. We all get muscle cramps occasionally, after exercise, dehydration, or even sleeping in an awkward position. But frequent, painful cramps can be a sign of deeper issues. Kidneys regulate electrolytes like calcium, sodium, and potassium. If these minerals fall out of balance, your muscles can spasm, twitch, or cramp unexpectedly. Sometimes the cramps are so strong they wake people up at night. Think of your muscles as a symphony orchestra. When all the instruments, minerals, are in tune, the music is smooth. But if one instrument goes off key, the harmony collapses. That's what happens in your muscles when kidney-related imbalances strike. 10. Nausea and vomiting. Feeling nauseous or throwing up regularly can be frightening, and one possible cause is kidney disease. When waste builds up in the bloodstream, a condition called uremia, it can upset your stomach. Food may taste strange, you might lose your desire to eat, and nausea may strike without warning. In advanced cases, vomiting happens often. Imagine waking up in the morning with a sour taste in your mouth and a stomach that feels uneasy, even though you haven't eaten anything unusual. If this continues, it's not just indigestion, your kidneys may be struggling. 11. Feeling cold all the time. Do you ever notice that you're shivering when everyone else around you feels comfortable? That constant chill could be linked to kidney issues. Here's why. Damaged kidneys often lead to anemia, fewer red blood cells, less oxygen, and a colder body. Some people even develop fever-like chills despite being in a warm room. Example, a person with kidney-related anemia may sit in a heated room wearing 2 sweaters and still feel cold to the bone. That's not just sensitivity to weather, it's the body crying for oxygen. 12. Difficulty concentrating and brain fog. Your brain needs oxygen and clean blood to function properly. When kidneys fail, toxins and waste cloud your blood, while anemia lowers oxygen supply. The result? Brain fog. This shows up as poor focus, short memory lapses, confusion, or difficulty completing simple tasks. Some people even describe it as feeling mentally stuck. Imagine reading a short paragraph and realizing you can't remember the first sentence, or struggling to follow a simple conversation. That frustrating fog isn't always stress. It could be your kidneys struggling in silence. 13. Metallic taste in mouth/bad breath, uremic feta. A common and early sign of kidney disease is a persistent metallic taste in the mouth or bad breath, medically called uremic feta. When your kidneys can't remove urea and other waste products efficiently, these toxins build up in your blood. Some of that urea reaches your saliva, where oral bacteria break it down into ammonia and other compounds. This reaction creates a distinct metallic taste, sometimes described as tasting like pennies, and a slightly urine-like odor on the breath. 14. Easy bruising/bleeding. Kidney disease can make your blood more prone to bruising or bleeding easily. Normally, tiny blood cells called platelets help form clots when you get injured, acting like your body's natural band-aid. However, in chronic kidney disease, uremic toxins interfere with platelet function, making them less sticky and less effective. This can lead to large bruises from minor bumps, gums bleeding when brushing, frequent nosebleeds, or slow healing of cuts. Even patients who didn't notice any trauma may develop unexpected bruising, which can be a subtle but important clue that the kidneys aren't filtering toxins properly. 15. Uremic frost, late sign. In advanced kidney failure, you might see a rare but striking sign called uremic frost. When kidney function drops dramatically, sweat can become saturated with urea and other nitrogenous waste products. As the sweat evaporates, it leaves a fine white powder of crystals on the skin, often on the face, neck, or chest. This is not just cosmetic. It indicates severe accumulation of toxins in the blood and signals that urgent medical evaluation is needed. While rare today thanks to modern dialysis, recognizing uremic frost can help identify patients at risk for life-threatening complications. 16. Pericarditis, inflammation around the heart. Chronic kidney disease can lead to inflammation of the pericardium, the thin sac surrounding the heart, a condition called uremic pericarditis. Unlike a sore joint, the heart keeps beating constantly, and the rubbing of inflamed tissue against the heart can cause sharp, persistent chest pain. Doctors can sometimes hear a scratchy or friction-like sound with a stethoscope, known as a pericardial friction rub. If untreated, pericarditis can lead to fluid accumulation around the heart, pericardial effusion, or even compromise heart function, making it a serious complication of advanced kidney disease. 17. No symptoms at all. And here's the most dangerous sign of all. Sometimes there are no warning signs. Kidney disease can quietly progress for years without obvious symptoms. By the time swelling, fatigue, or rashes appear, damage may already be advanced. That's why regular checkups, urine tests, and blood work are so important, especially if you have diabetes, high blood pressure, or a family history of kidney problems. It's like a silent leak in your home's foundation. You don't notice until the floor collapses. Prevention and early detection are your strongest weapons. Final message. Your kidneys are small, but their job is massive, filtering blood, balancing minerals, producing hormones, and keeping your whole body stable. The 17 signs we covered, from foamy urine and leg swelling to fatigue, nausea, and even bad breath, are your body's warning system. Don't ignore them. The earlier you notice, the sooner you can protect your kidneys through lifestyle changes, proper hydration, a balanced diet, managing blood pressure and sugar, and avoiding overuse of painkillers like ibuprofen. Remember, your kidneys may be silent, but they're always working for you. Treat them well, and they'll keep you healthy for years to come. Stay curious, stay healthy, and I'll see you in the next video.